Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Vaginal birth after a cesarean delivery, VBAC. Introduction. Women who have had a baby previously by cesarean section may still be able to have their next child through vaginal birth. Mothers who have had a cesarean section or C-section previously can choose to either schedule another cesarean or they may be able to try to deliver vaginally. This is known as a trial of labor after cesarean, or TOLAC. About 60 to 80% of women who try a TOLAC are able to have their baby vaginally. This is known as vaginal birth after cesarean, or VBAC. This program reviews the anatomy of the female reproductive system and explains TOLAC and VBAC. It also discusses the potential benefits, risks, and complications of TOLAC and VBAC. Anatomy. In order to understand TOLAC and VBAC, it is important to know about the anatomy of the female reproductive organs. They are located in the pelvis, between the urinary bladder and the rectum. The female reproductive organs include the vagina, the cervix, the uterus, the fallopian tubes, the ovaries. When an ovary releases an egg, the egg goes down the fallopian tube to the uterus. It may become fertilized along the way. If a woman gets pregnant, the fetus stays in the uterus until delivery. The uterus is able to expand a lot. The lowest part of the uterus is called the cervix. It opens into the vagina, which opens to the outside of the body between the urethra, the urinary bladder opening, and the rectum. TOLAC. Mothers who have had a prior cesarean section and choose to try to have their baby vaginally undergo what is known as a trial of labor after a cesarean delivery, or TOLAC. TOLAC is similar to regular labor. The main difference is the chance to switch to an emergency C-section is higher than in regular labor. Labor starts when the mother feels cramps in her abdomen. The cramps are the uterus muscles tightening or contracting. When contractions start, they usually happen about every 20 minutes. As they keep happening, there is less and less time between them. The body is ready to push the baby out when there are only 5 minutes between contractions. There are 3 stages of labor. 1. Dilation and effacement stage. 2. Baby delivery stage. 3. Placenta delivery stage. During the dilation and effacement stage, the cervix slowly becomes 10 centimeters wide. This is called dilation. The cervix also becomes thinner. This is called effacement. When the cervix is completely effaced and dilated, the mother is asked to push. The baby delivery stage starts when the cervix is 10 centimeters wide. This is about 4 inches. This is when the mother is asked to push during contractions. If the TOLAC is successful, the baby moves through the cervix and vagina and comes out. This is known as vaginal birth after cesarean delivery, or VBAC. The path the baby travels through is called the birth canal. After the baby is delivered, the placenta delivery stage starts. This is when the placenta comes out or is delivered. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. TOLAC versus planned C-section. Women who have had previous C-sections may choose to have a planned C-section for their next delivery. They may also be able to choose a TOLAC. TOLAC and planned C-sections have their own risks and benefits. Both TOLAC and planned C-section carry the following risks: infection, bleeding, injury to the mother or baby, Other complications. TOLAC and successful VBAC have the benefit of a shorter healing time than C-section. The risks of blood loss and infection are lower than C-section. Avoiding multiple C-sections can lower your risk of hysterectomy, bladder and bowel problems, and placenta problems. In cases of TOLAC, there is a risk that the scar on the uterus from the previous C-section could break open and lead to the uterus rupturing. Uterine rupture is rare, but it can be dangerous to the mother and the baby. It could lead to life-threatening complications for the mother, including blood loss, damage to the bladder, infection, blood clots, the need for a hysterectomy. Uterine rupture and emergency C-section can lead to serious complications for the baby, including brain damage and death. The type of uterine incision used in your C-section affects the risk of uterine rupture. You will not be able to tell by looking at your body what kind of incision you had. The scar for your incision will be inside your body on your uterus. To find out what kind of incision you had, you will need to talk with your healthcare provider and check your medical records if possible. There are 3 kinds of uterine incisions used for C-section: low transverse, low vertical, and high vertical. Low transverse incision carries the lowest risk for uterine rupture and is the most common type of incision. There are 3 kinds of uterine incisions used for C-section: low transverse, low vertical, and high vertical. Low transverse incision carries the lowest risk for uterine rupture and is the most common type of incision. High vertical incisions carry the largest risk of uterine rupture. If the uterus ruptures, you will need an emergency unplanned C-section. Unplanned C-sections carry a higher risk than planned C-sections. Each person is different, and your risks and benefits may be affected by other factors. Talk with your healthcare provider about your choices. TOLAC and VBAC success. There are certain factors that affect how likely you are to have a successful TOLAC and VBAC. Previous successful vaginal births increase your likelihood to have a successful TOLAC and VBAC. If you had multiple C-sections or previous uterine rupture, you may not be a good candidate for TOLAC. If your pregnancy has a complication that makes VBAC too risky, your healthcare provider may recommend a C-section. The older you are, the more likely it is that your TOLAC will not be successful. If you have a high body mass index, or BMI, it is less likely that you will have a successful TOLAC and VBAC. Other factors that make TOLAC and VBAC less likely to be successful include baby with a high weight, pregnancy that is over 40 weeks long, previous pregnancy that was recent, pain control. If you have a TOLAC and VBAC or a planned C-section, you may need some form of anesthesia to relieve the pain of labor and delivery. There are many ways to control pain experienced with delivery. These include 1. Medication. 2. Regional anesthesia. 3. Epidural block. Intravenous medications are given in a blood vein. They can relieve some pain, but they may cause the mother to feel sleepy or nauseous. Intravenous medication can also affect the baby since some of it gets into the baby's blood. This may make the baby groggy. Regional anesthesia is delivered with a needle through the vagina to numb the pudendal nerve. This relieves some pain and the mother can still feel her contractions and help push. The most common way to control pain during delivery is the epidural block. It is used for vaginal deliveries and cesarean sections. Medication is delivered to the nerves of the spine and the lower back. An epidural block is successful in eliminating pain while preserving muscle strength so the mother can push the baby out. It does not affect the baby. Rarely during a C-section, the mother is put under general anesthesia. During general anesthesia, the mother is put into a deep sleep. After TOLAC and VBAC. Women should get out of bed and walk shortly after a TOLAC and VBAC. This helps blood circulate in the legs and prevents blood clots. Blood clots can be lethal. The nurses in the hospital or your midwife will teach you the best ways to take care of your baby. They will also help you with breastfeeding and answer any questions you may have. Some vaginal bleeding and spotting after a delivery are normal. If you have heavy bleeding or if it is foul-smelling, you should contact a healthcare provider. It is normal to feel some soreness in the genital area after a delivery. This could last anywhere from a few days to a couple weeks. Sexual intercourse is usually not recommended for 6 weeks after a TOLAC and VBAC. Some women may have mood swings or feel depressed after a delivery. Tell your healthcare provider about your emotions. He or she may be able to help you overcome these feelings. It takes several weeks for a woman's uterus and vagina to go back to the size they were before the pregnancy.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Mothers who have had a cesarean section or C-section previously can choose to either schedule another cesarean or they may be able to try to deliver vaginally. This is known as a trial of labor after cesarean, or TOLAC. About 60 to 80% of women who try a TOLAC are able to have their baby vaginally. This is known as vaginal-birth-after-cesarean, or VBAC. TOLAC and successful VBAC have the benefit of a shorter healing time than C-section. The risks of blood loss and infection are lower than C-section. TOLAC and planned C-sections both have their own risks and benefits. Some risks are more serious than others. Both TOLAC and planned C-section carry the following risks: infection, bleeding, injury to the mother or baby, other complications. TOLAC can result in uterine rupture and can be dangerous to the mother and the baby. It could lead to life-threatening complications for the mother, including blood loss, damage to the bladder, infection, blood clots, and a hysterectomy. It can also lead to serious complications for the baby, including brain damage and death. If you have a TOLAC and VBAC or a planned C-section, you may need some form of anesthesia to relieve the pain of labor and delivery. There are many ways to control pain experienced with delivery. These include 1. Medication. 2. Regional anesthesia. 3. Epidural block. Each person is different, and your risks and benefits may be affected by other factors. Talk with your healthcare provider about your choices. Thank you for using Explain.